Attention deficit hyperactivity disorder, defined in an article written by Mayo Clinic staff, is defined as a chronic condition that affects millions of children and often persists into adulthood. ADHD is a genetic disorder and includes some combination of problems such as difficulty sustaining attention, hyperactivity, and impulsive behavior. Children with ADHD may also struggle with low self-esteem, troubled relationships, and poor performances in school. Detecting ADHD in your child is done by looking at the symptoms. These symptoms can vary from anything to inability to focus, being easily distracted, being very unorganized and unable to sit still, to acting very impulsive and acting out, causing them to get in trouble. In the video spoken by John Bosworth, he is going to explain in depth the symptoms that come along with ADHD and finding them in your child.
Hi, my name is John Bosworth. I'm a licensed mental health counselor in St. Petersburg, Florida. I'd like to talk a little bit about the signs of ADHD, or attention deficit hyperactivity disorder, in children. A lot of the signs of ADHD in children are basically self-explanatory. You can see irritability, distractibility, can't finish tasks, can't follow directions, loses things, loses homework, has trouble interacting with peers because of distractibility. The other side of ADHD, the H side, is what I like to call the impulsive side. Usually there's the impulsivity part that a lot of people forget, which is blurts out things in class, is disrespectful or disruptive to others, has a hard time waiting in line, maybe interrupts people. Those kind of things are usually impulse control problems associated with ADHD. With a true diagnosis of ADHD, we're going to want to look at both sides. We're going to want to look at the attention side, or the cognitive impairments, and we're also going to want to look at the behavioral impulsivity problems or impulse control problems. So what we're going to want to do is get an evaluation or assessment from people such as parents or primary caregivers along with teachers, and kind of get a history of how long this behavior and those behavioral symptoms have been present in the child. And usually for a full diagnosis, we want symptoms that are pretty much manifest before the age of 7, okay? So there may be other signs of distractibility, but usually if those symptoms, 4 or 5 of them are present before the age of 7, we have a pretty good idea that that might be an indication of ADHD. My name is John Bosworth, and I'm talking about signs of ADHD in children.
There are treatments for ADHD, however, they are not long-term. There is medication to control some of the symptoms such as hyperactivity, impulsivity, and the inability to focus. One of the many and most commonly known examples of medication is called Adderall. The drugs.com definition explains that Adderall is a central nervous system stimulant that affects the chemicals of the brain and the nerves that contribute to hyperactivity and impulse control. Since the medication is a stimulant drug and it alters the way the brain works, and since every child is different, the dose of the medication will vary. When anyone is diagnosed with ADHD, their brain looks different from a child who does not have ADHD. The picture shows the comparison between the two. In the article, ADHD Neurology, the Brain of Inattentive Impulsivity and Hyperactivity, it shows that children with ADHD show excessive slow brain activity compared to children who do not have ADHD. The slow brainwave inactivity indicates a lack of control of the cortex of the brain. But just because someone has ADHD does not mean they cannot accomplish the same task that a child without ADHD can.
I have ADD.
I have ADHD and I'm a first class Boy Scout.
I'm a talented sprinter and I have ADHD.
I have ADHD and I am a very energetic dancer.
I'm a poet and I have ADHD.
I have ADHD. I'm a bit disorganized, but I have a 3.8 GPA in college.
I'm a good writer.
I have ADHD and I'm a successful financial planner and I love spending time with my kids.
I have ADHD and I'm a perfectly normal kid.
I'm all of the above.